Who's paying for it?
Okay, I see a lot of people who want to save the ACA, but they don't tell me why it's worth saving. Impeach the president and Trump?
Yeah.
So who do you think is the president?
It's a combination of Bannon and Putin.
Okay, so why do you think Bannon is president? He wasn't elected president.
He was not elected president.
Okay, so you think he's like the power behind the throne?
He has tremendous undue influence, yes.
But why? Why do you say
Why does
that?
he have that?
Why do you say that Bannon is...
Because he's a smart
Okay.
guy.
So is Trump.
No, he's not.
Why do you... Okay, but if your criteria is smart, that doesn't mean anything. There's lots of smart people here. They're not president.
He's smart and he's evil.
But there's a lot of smart evil people. Henry Waxman was one of them, and so was Nancy Pelosi.
And they're not in the White House.
So what is... But Bannon's like an advisor. You're saying he's the president?
Yes.
Where's the proof of this?
Well, I can't say that I can prove it, just as I can't say that I can't prove that Cheney was in charge during the Bush years. But
Okay.
you know what?
That's because he wasn't. Cheney was the vice president. He was not in charge. And neither is Mr. Bannon. That's not true. Now, you mentioned who is it? Putin?
Yes.
Okay, so you're going with that line. Where is the evidence that Vladimir Putin is the real president of the United States?
Well, every day there's more and more evidence being uncovered that Putin is...
Why? What evidence?
Trump is in Putin's back pocket.
How do you know this?
All the connections that keep surfacing.
Give me one connection.
Connections between...
You can hear it. He's got a bigger microphone than I do. If you're going to put a sign like that, which isn't true, you need to be prepared to back it up. And you have not done that.
You're just not listening.
I have listened to you. I asked you questions.
We're trying to hear
I
this.
answered your question.
You can hear it. He's got a
No, I
microphone.
said we're
I don't.
trying to hear this.
Then you can move ahead.
No, then you
Thank
can
you.
move out.
No, I don't have to.
Yeah, you can
Public
move
place.
out.
Okay, coverage for all. Who would pay for it?
We're already paying for it.
No, we're not paying for it.
Wait, I want to talk to you.
He does want to talk to me. Why are you preventing him?
go
Kindly
back
move
here.
over
That's
there
over
by
here.
the police horses, you know, so we can listen.
You can actually listen even if I'm standing here.
Let's talk.
Not with you talking.
Maybe you're the one talking. Thank you for your service. I appreciate it. Okay, go ahead.
All right, so we're already paying for everyone's health care because when they get real sick, they end up in the ER. So
Okay, so
that's the
we got a
reality.
real problem because emergency rooms are required to provide service by law.
That's right.
So there's one way we can solve this problem. Illegal aliens shouldn't be using our healthcare. Period. That would solve 38% of our problem right there. So that's the first thing. You don't agree with that?
No, I don't. People are people. We live on the same planet. We got to take care of everyone, and we need an affordable way to take
But
care
we
of
can't take care of everyone. There's not enough
So,
resources. There's not
let
enough
'em
people.
die, let
I
'em
agree.
die.
I don't believe in letting people die. I believe in helping people to take care of themselves. I believe in
Well,
making
you
it
said-
easier to... Let me finish, because you asked me a question. I appreciate it. I believe in making it easier for people to purchase health insurance, buy it across state lines, health savings accounts, make it easier to practice medicine. Medical personnel, they have to get a license to practice medicine in every single state. Does that make sense? If you're from Wyoming, Montana, Rhode Island, you're a human being, right? It shouldn't matter. Do you know that
I'm with you on
licensure
that.
laws?
I'm with you. At
Good,
national
okay.
Licensing, I like.
No, I don't like nationalizing. I want to make it as local as possible. I emphatically disagree. So let me ask you a question. Do you support single payer?
Yes.
Why?
Well, because it's a lot more economical than using emergency rooms for.
I would emphatically disagree with
can't
you.
afford.
In France, for example, they have a quasi system. What they do, the cost overruns are in the billions. In the United Kingdom, you have waiting times that are 6 weeks to 6 months. You have women who have to give birth to children in the hallways because they can't get a doctor. You have medical personnel from other countries who practice medicine without a license, which is quote unquote illegal. In Canada, a man had to sue all the way to the Supreme Court of Quebec just for the right to purchase health insurance because he could. The government would not allow him to get better care. I don't agree with that. And why did he have to get better care? Because the government care is terrible. Single payer is the worst thing possible.
Okay, can I speak now?
Go for it.
Oh, great. So the satisfaction with healthcare is higher in the UK. It's higher in